This is the Whole Care Network. Helping you tell your story one podcast at a time. The following CareLab podcast does not provide health or medical advice. All content is provided for information purposes only. Listeners are encouraged to speak with their healthcare provider for specific healthcare advice and are wholly responsible for the outcome of implementing any tips or information presented.
Hi, welcome to CareLab.
It's CareLab Day. How's it going?
It's going pretty well. You know, it's Friday. I've got things to look forward to this weekend. How about you?
It's going good. I like the change in the seasons. So it's not quite as hot as it has been, and there's different fun fall things to be doing. And so yeah, it feels good.
Yeah, for sure. Okay. Are you ready to dive right in here today?
I think so. I was just about to ask you, it's just me and you. Do we need to do icebreaker? Do we need to do that? Can we just do something else?
I think no, I don't think we need to do, and frankly, to be honest with you, full transparency, I don't have a good icebreaker question to ask you. And I feel like at this point in our relationship, Brandy, we might be beyond icebreakers, just the two of us.
Well, I have one good thing.
Okay.
We have never met each other in person.
That's true.
One thing I don't know about you. How tall are you?
That's exactly what I was just wondering. I am 5'5". How tall are you?
I am 5'10".
Whoa, dude, you're tall.
Yeah. So maybe the cover of our CareLab is not very accurate.
It
makes us look like we're pretty close.
It does. I'm extremely average and you're pretty tall. Yeah, we should probably fix that in some way. The problem with like perspective is that if we actually make you look that much taller than me in these pictures side by side, you're just going to look like a giant.
A giant monster.
Yeah. Which I don't think you I don't think you look like a giant monster.
I was worried.
Yeah. So
okay, now I think we know everything. But
now we know everything. What's your favorite color? No, please don't.
I mean, you know. But you know, one thing that I don't think that our listeners know a lot about is the reason they know a lot about us being OTs. We love to talk about OT.
Sure.
And they know that we're here because we care deeply about educating caregivers, because it's a wild world in healthcare and you need to be armed with information.
Yeah.
We want to give that to you. But I don't think they know why we are not working in hospitals and like why we have businesses. And so I think it'd be great if we let them in on that.
Yeah, that is actually a really good idea, because it is kind of strange actually for two occupational therapists. Well, not strange exactly, but it's unusual. It's not always common for OTs to be out in the business world. There aren't a lot of OTs who are, with podcasts and things like that. And so,
although it's growing, more people are coming out of the clinic and using their skills in different ways. It's definitely growing.
That's true. And that is really, really exciting to me, because occupational therapists have so much more to offer the world than, just the things that fit into a box in a clinic. Right. But yeah, so let's talk about today. So can I start by asking you, first, you should probably define I know what Ask Sammy is, but you should define for listeners who might not know what is Ask Sammy.
Okay. So Ask Sammy, and what we do is help people get the right adaptive equipment and resources and services so that they can age in place well. We have found in our careers that there are three main things that help people be successful at home, and that's the environment accommodates your needs, that you are able to use your community resources, and that you're connected with the right services to support your independence or your caregiving. And so the unfortunate part about that is all of that is spread out in different places in the world, and on the internet, and we're putting it all in one place. So that's easy to find.
Can I just tell you, and I think you know this already, but like when we very first met, how long ago did we meet?
Year and a half,
Year and a half, maybe 2 years? I don't know,
maybe
something like
two.
that.
Mm-hmm.
And you told me what Ask Sammy did. I was so blown away by how, like, just what a great idea that was to help genuinely get people what they need. Because that's one of the biggest hurdles I think for folks to get over is like getting the right equipment for their needs is actually a really really big deal. And how often have you seen problems that have occurred because people have not been connected with that right equipment or those right resources, right? So like creating this
Mm-hmm.
really really simple solution to make it so people are actually getting the appropriate equipment for the appropriate need. It sounds really simple, but it didn't exist before. And
Yeah.
the amount of impact and good that it can do in the world, like I was so blown away by that and continue to be. I fangirl on you all day long
I
because it's
appreciate
amazing.
that.
Yeah.
Well, like it's been like a journey to get to where it is right now, but
Hmm.
it really initiated it because of my work as an OT, like in the clinic. So, okay, I our job is to help people be as independent and as safe as possible,
Yeah.
right? And if it's not a knee or a hip or something that's going to get better, which most of my practice has been focused with older adults, so a lot of the stuff that they're dealing with is not really going to get better.
Hmm.
Um, because we're dealing with Parkinson's and stroke, and there's improvement, but it's still like very impactful to your life. So now, if I can't like regenerate or fix you, what can I do to make you be more independent? And so I've always leaned into, okay, maybe the environment can just better support you. We do this for kids all the time. They have shorter beds so they can climb in, and schools have little desks so they can fit in them. Like, why would you force them to be in something that doesn't work for their bodies? Same thing applies to us as adults, I think. And so I spent so much time gathering resources and learning about the new gadgets that are out there. That's not a burden to me. I love doing that
Hmm.
because, inventors are making stuff to solve problems. And that's awesome. The problem is the people who need it don't know about it until, oh, I wish I would have known that 2 years ago when my dad first had a stroke. That we could have totally used that would make our life so much easier. And that's why the inventor made it, but you just didn't know that existed. That feels ridiculous to me, right? And so I just kept on trying to be a Rolodex of all this stuff and just keep gathering information and then like spit it out at the right time to the right patient. Like, oh, I learned about this thing. You need to know that thing. And frankly, it was fun to do, but exhausting because as
Hmm.
soon as I found a way to like provide that to somebody, print out a paper, make a database, whatever, like it kind of became obsolete. Like the store
Yeah.
wouldn't carry it anymore, the link is broken or whatever. And it just got
Or
to
also
be
like
like
people
too
lose
hard.
those pieces of paper, right? They
Yeah.
like stuff gets misplaced or they forget or whatever it is. And so like you did all of this work to make sure someone is able to get what they needed and then
They lose it. And then also, if I'm not at work that day
hmm.
and the said person calls back and it's like, oh, she gave me this, like, there's no record of that. Nobody else knows it. It's only in my head. And that didn't feel right to me. And
Hmm.
so um, I left and made my own business and started like doing that for the people, the community in Kansas City.
Hmm.
And that first business was accessible living. And so that was cool too, but it only worked for as far as we could drive. Kansas City happens to be like a pretty big place. It like encompasses quite a few miles. You could drive for an hour and without traffic and still be in Kansas City's metro limits.
Wow.
And
I didn't
so,
realize it. It's huge.
yeah, they used annexing very well. So like it's just a big community. So there's and so we would get referrals for people that lived outside of a economical range for us to drive to and provide service, and that didn't feel right. And that's not even like rural for real. It's just like not in our downtown.
Yeah.
And so that's how we came to the idea of turning it into something digital. That way, anybody anywhere could access the information. And now we're just like hoarding all the resources, pulling all one into place. So now you only have one place to go to get all this stuff. And I don't have to be present to do it. You don't have to connect with me. You can do it independently on your own. You can connect with an OT on the site. But if you really want some additional help, but it's made to democratize the information around aging in place.
And can I point out one more thing that I think is really important about Ask Sammy, it is the fact that it is run by you as an occupational therapist and created like from your occupational therapy mind. Because I think that there are other sites that have attempted to do what you have done, and they just frankly haven't really done it. They haven't done certainly as well as you have, and they haven't achieved that same goal because they're not looking at it through that same lens. And there's a value that Ask Sammy brings to the table because it's occupational therapy led and based that I think other sites just really, they just can't touch, if I'm being honest. It makes a difference.
I do think it makes a difference because it comes from experience. It's not just an amalgamation of all the things possible. It's the things that are easy to use. We've used them with our own patients, and it solves a real problem. There's a whole lot of stuff actually marketed that sounds fancy and cool, but like it doesn't actually solve a problem. It's just spending money on something to, because it sounds cool. And so we're narrowing the wide world of what could exist down to the stuff that we know works really well. And then, but in that same breath, adding as many things as possible in all of the things that would touch your life, I guess is what I'm saying. Anything that could be beneficial to you. We want to have at least one of them there so that you can find it all in one place, because ain't nobody got time for that, basically. Like whether you're a therapist trying to refer your patients to get the stuff they need, you ain't got time for looking all this up. And if you're a family trying to figure it out for your mother who lives 2 states away, like you ain't got time to be Googling and get whatever happens to be well resourced and paid for ads. You want to know what works. And so I think that's the biggest value. It's not like you can't find this stuff on your own. You could. It's all on the internet. But the value is that we've put it in one place and we've verified it for you.
Hey there, it's Emilia. Listen, I am so thrilled to have a great resource like Ask Sammy as part of the CareLab team, and here's why. It's a game changer for aging in place because it makes it so simple. All you do is ask. Just type in your question or even tell Sammy what the problem is and get tailored solutions. Everything from innovative adaptive equipment to comprehensive resources. It's a great way to become more empowered, to live more independently, and to live with greater confidence. And my favorite thing about how Ask Sammy works is it's deeply rooted in dignity and practicality. So whether you're a fellow therapist, a care partner, or someone who's seeking solutions for themselves, visit www.asksammy.com. We're going to link it in the show notes so you can find it there. Start making home more accessible today. Now, back to the show. And you've also done a good job curating what people actually see when they put in their problems. So if you go to Ask Sammy, you take a little quiz, it will basically ask you what kinds of issues you're seeing or functional problems you're having. And it's not going to spit every single thing out at you and then leave you like wandering through this wilderness of stuff to decide. It says, okay, if this is the specific problem, then these are the solutions that are likely to work for you, right? And again, that's really different than just going on Google and getting anything that happens to have a keyword match, or getting anything on a site that, again, happens to have a keyword match with whatever search you put in for, if it's, feeding or transfers or equipment or whatever. It makes it impossible to sort through 100 items if you get 100 items. Like, no one wants that. No one can do that. No one's got time for that. Like you said, Ask Sammy does that for you. So instead of 100 things to look at, you have just a few things to look at. And from there, it's really easy to decide. And like you said, it's verified. Like, okay, this is actually going to help with my problem. What a relief.
Yeah, that's how we feel about it. It's like I've worked a lot of places. All the settings. I literally have worked in all the settings, except for schools. That's the only one I haven't done. And burns. But everywhere else I've worked. But all of that time, I always did home health on the side if it wasn't my full-time job. Because I don't know. I like going to people's houses and doing OT. I think it's awesome. And the number of times I have seen somebody have perfectly good adaptive equipment piled up in the garage or sitting in a basement because while it is a good shower chair, it's not the right shower chair for that person, and it didn't work for them for whatever reason. And that's wasted money and wasted effort. And also, a lot of times they don't have a replacement. They don't have the right one. They just know that they don't like that one and that
Yeah.
one didn't work. And so they still probably have the need, right? There's still a balance issue. There's still some struggle. And so that's like unsafe time. Maybe more falls have happened because of that. And that don't even make any sense to me. You know, like that shouldn't be the case. In this world that we're in right now and all of the resources that we have available to us. And so that was the impetus for it. So that's what we do.
Awesome. Amazing. People should check that out for sure. Sammy.com.
Yeah, I mean, go to asksammy.com. You should do it. You should share it as a resource. If you're a therapist, you should use it. Oh, okay. One of the cool things that I don't know when this is going to come out and when we're going to be ready, but I'm trying to help not just the family, but also us, the me of 2010 who was doing all this research, right?
Mm-hmm.
And so soon you'll be able to, as a clinician, whether it's an OT or a social worker or whoever is working with the family, go on, build a cart of stuff that you are recommending. And that can be all the things, like a resource, a service, or a product, and type in why you think they need it or put some notes towards it and share that with the family. So then they can easily access all the links to all the things in one fell swoop, and you didn't have to organize all that. And we keep that up to date. Like we make sure that product is available and not out of stock, and that service still exists, and that phone number works. And so you don't have to do that.
That's going to be very cool. That's going to be very, very cool.
Excited. Yeah, I'm excited about that part. So yeah, so if you're a professional and you're making recommendations to seniors, you should get a user account. It's free. So Emilia, you also have a business.
I do indeed.
And left the traditional clinical world. So why did you do that?
Well, I should start by saying that I actually love being a clinician. I love treating patients. I've worked in pretty much every adult setting except for like LTACs. No peds for me, but pretty much every adult setting I have worked there. And I loved it all. I just really, really enjoy being a clinician and getting to see those moments of progress. And when people when someone does something that they didn't think that they could do.
Yes.
Or they see that it's possible for them to do something that they didn't think they could do. Like that is the most wonderful moment you can imagine. And I just eat that up. So for me to leave that, I had to be really, really motivated that there was a bigger problem that I could solve. And I initially left traditional clinical practice and opened up a private practice doing home modifications. And the reason that I did that was really because I got so tired of seeing people in the hospital that just didn't need to be in the hospital. And I knew that if I could get to them beforehand, that I could prevent harm and really increase people's quality of life. And that was my initial motivation. So I went and I started that, doing home modifications. And what I then came upon, because sometimes the first business idea that you have that you think is going to be the thing, it's not always the thing.
It's
right?
not always the thing. Yep, that's mostly true, actually.
It's mostly true. It's not always the thing. So what I was finding, though, was that I'd be in people's homes and I basically kept getting slapped in the face with the fact that the caregivers who were there, both family caregivers as well as the professional non-medical caregivers who were often in these situations to help out, just did not have the skills that they needed in order to safely care for the people that they were caring for. And so I found myself a lot of times in these situations, I might be called in to take a look at someone's bathroom setup. That's the most common reason I get a call, right? Can you come look at, can't get in the shower. Can you come look at the shower? So I'd be in there for that, but then I'd also see, okay, this person also needs transfer training, or I'm there and they also are asking me, how do I turn this person in bed? How do I, do this? How do I do that? The urine collection bag is way up high and it needs to be down low. So at the same time, I'm supposed to be there to do all, just home modification, purely looking at the environment. I kept finding that there was such a great need for skills education. And it's not rocket science, okay? It's just knowledge. And
Sometimes you just need to know how to do a thing.
You just need to know how to do the thing. And I feel really fortunate that because of being an occupational therapist, it's equipped me in order to really give these people the skills and the knowledge that they need in a way that they can apply in their daily life. So I kind of was seeing that was a need, but then also I was like, I'm just one person. There are, like in Texas alone, where I am, there are something like 3 million caregivers.
This is like family caregivers and like professional caregivers?
That's actually just family caregivers. There are millions more non-medical professional caregivers. Okay. This is just in one state. And I'm just little old me. And so I can't go to all of those houses.
You can't get to all those houses.
I can't get to all those houses. And you know what? If you took every occupational therapist in the state of Texas, we still couldn't meet all of those needs, right? There are just not enough of us. So I saw this big problem. I knew that I had these skills and the knowledge to genuinely help solve it for people. And then it just became a matter of how do I figure out how to provide this information in a way that everyone can access and they can get to it in a way that they can afford. They can get to it without needing to have a doctor's order to see an occupational therapist, right? And so I went about solving that problem essentially by starting to create my video library of content at Higher Standards Caregiver Training, really going through all of the things that I had trained people on in person, hundreds, maybe thousands of times in person through the course of my career. And really kind of creating that content and curating it based on how the real world really looks and the actual questions that I had been asked hundreds of times, and knowing what people were likely to need or to know based on different scenarios. So, for me, it was just a matter of like creating that course library and starting to put it out into the world in a way that was open and accessible for people to get. And of course, we provide a lot of training content for non-medical home care agencies. Those are kind of our primary customer, but we still also have training content for family caregivers at Higher Standards Caregiver Training too, because the goal is to improve as many lives as possible through, again, just good quality education.
But Emilia, don't the people get trained before they discharge home?
Ha ha ha. That's a good question. Well, yes and no.
I trained many people. I did train many people before they discharge home.
Yeah.
But what's the problem between like, even if you do get trained at home, to like translating that to actual home?
Yeah. So to kind of answer your question fully. Yeah. And of course, that's where my basic training knowledge comes from, is I've trained, untold number of people in all these different settings, right? So of course, we're out there providing this training.
CareLab listener, I have a question for you. If someone you love was going to hire a caregiver, what qualities would you want that caregiver to have? You probably want them to be reliable, trustworthy, kind maybe, just a generally dependable good person, right? Second question, would you also want them to be trained? I'm going to guess the answer is an emphatic yes. Okay, third and final question for you. Do you think it matters who provides that training? Like, is it cool if it's just anybody? Or would you want that person providing the training to be a qualified expert? Assuming you do, in fact, love this person that needs a caregiver, you probably want the expert, right? Well, that's what Higher Standards Caregiver Training does. Higher Standards Caregiver Training provides 100% occupational therapist-led training for caregivers. Caregivers get taught everything from gold standard foundational skills for transfers and activities of daily living, all the way up to how to deal with specific diseases, injuries, and illnesses. And most importantly, they are taught these things in a practical way that enhances the participation of the person being cared for, and it protects the safety of everybody involved. Why? Because everybody deserves a higher standard. Find a course for individuals or learn about training for care organizations at Higher Standards caregivertraining.com.
I think that there are two answers to that question. One, that everyone actually doesn't get that training. We want that to be true. We hope that's true, but the fact is it's not necessarily true. If your doctor doesn't write that order, or if for whatever reason the staffing situation doesn't allow that to happen before you get discharged home from the hospital, then you probably won't necessarily get that training. And the second part of it is, again, yes, of course, we are out there training as much as we can in rehabs and at hospitals before people, and in outpatient, when people are going home. But you don't necessarily absorb everything that you are being taught during those trainings, right? Like, it's a very stressful time for people. There are a lot of things on their minds. You're getting a lot of education from a lot of different disciplines about what needs to go on at home. And so you're probably not going to remember everything. It takes most people 7 to 8 times of hearing information before they can apply the information. 7 to 8 times. So
you're not getting 7 to 8 training sessions at rehab. You're hardly there for 7 days, to be honest with you. But like, if you're working and doing other things, like, you can't be there at every therapy session and put your hands on the person on every therapy session, even in the best case scenario. So it means that everybody's at a deficit.
Everybody is at a deficit, no matter where you're coming from.
No matter what.
So there's just no way that you are actually able to remember and apply all of that information. That's just not how brains work, basically. The other part of it is that home looks really different a lot of the time from the way the rehab or the hospital is, right? And so while we hope, again, that you're being trained as closely as you can based on your individual environment at home, sometimes that doesn't always happen. And so the way that I have tried to create the education on higherstandardstraining.com is really about teaching you how to navigate problems and situations using like the best possible standards and the best possible decision-making tools, but wherever and however your situation looks. Because let's be honest, like, caregiving is not paint by numbers. You do have to make decisions no matter who you are, right? And so it's not saying, well, this is where you put the chair and this is how you lock the brakes and this is how, you do XYZ of a transfer. Although certainly we go over those scenarios, but it's more about saying, how do we make good decisions in the situations that we're in by applying the right rules and principles to this situation. So kind of similar to how you do it at Ask Sammy, where you're using your OT brain to help guide people in the right direction. All of the education on higherstandardscaregivertraining.com is geared to use an OT brain and give that OT brain to the person who is actually there in the situation to help them make good care decisions from that point forward. And when we do that, we can really, really influence positive outcomes. If you think about it, who is there with people who need care all the time? It's not me.
Nope.
It's not the doctor. It's not the nurse. Like, we have little check-ins, right? But the person who's there all day long is the caregiver. So who has the biggest impact on the healthcare outcomes and quality of life? I would argue all day long that it is lay people who are caregivers who actually have the biggest impact. So if we arm caregivers with the right knowledge and tool set, how many wounds can we prevent? How many cases of aspiration pneumonia can we prevent? How many unnecessary UTIs can we prevent? How many falls do you think we can prevent? There's no limit to what we can help with by simply giving people good information. And so that's the goal.
That's why higher standards caregiver training is so valuable, I think, because we live in this very microwave kind of age where it's like, okay, let me watch a little reel, a little TikTok, a little short 30-second video, and I'll know how to do this thing. And in some cases, that's fine. right? But when you're thinking about the whole person, the whole picture, it's not cookie cutter. It's not like it was at rehab. It's not like it was maybe even in your video, but because the videos are longer, which is the thing I love about it, and it goes through like your thought process behind how to make a decision. Now I know how to think about it for my own self in my own home, or even when we make a change. And yeah, I know how to do caregiving at our house, but when we go to Thanksgiving dinner, how are we going to do the toilet at the other person's house, right? Like we want to be able to go. We don't want to have to stay here. When you're armed with the way to think about it and the way to decide and to be prepared, it makes everything so much better. And that can extrapolate out to all the situations in which you might find yourself in, which is the goal, right? Because we don't want to keep people staying at home in their bedroom. That's the only place that they access, because that's the only place y'all feel comfortable and safe. We want you to feel like you can live life, right? Like living life to its fullest is one of OT's slogans from in the past, And so I think that's why I love what you do so much and why I think it's so important. And like the other one thing that you have to talk about
Okay.
is how much training do hired caregivers get?
Ooh, okay. Well, that depends very much on the state that you're in. The vast majority of states, and also depends how the caregiver is defined, right? So home health aides get a basic level of training. They're required to, basically because of Medicaid, because of the payer source, they're required to have a certain amount of training to become a home health aide, right? We know that CNAs are certified nursing assistants, so they are getting a basic level of education. But then there are these other folks who fall into the bucket of non-medical caregivers. And again, kind of depending on the state where you're at, they might be called different things. They could be called like personal care assistants. They could be called companions. They could sometimes it's just like private duty, right? It depends where you're at exactly, like what they're called. But the long and short of it, there are these non-medical caregivers, right? So they are not required in the majority of states to have any training at all.
Wait, say that for the people in the back. In most states, they're
in
not
most
required.
states, non-medical caregivers are not required to have any training at all. If you think that's insane, it's because it is. And what I would also say is in some ways there are reasons for that, right?
Yeah.
The more training someone is required to have, the more expensive that individual becomes, the more expensive services become. And let's be honest, it's already hard for people to afford to have a private caregiver in their home if that's something that they need. But at the same time, what these people do is so, so, so important. We can't ignore the fact that for their own health and well-being and confidence, as well as the health and well-being of the people that they're caring for, they deserve better. They deserve to be trained in a way that allows them to do their job confidently and competently. And again, that's kind of what we're all about at Higher Standards Caregiver Training. Like, it's about arming these people who maybe aren't required to have this information, but they should have this information, right? If we really care about what we're doing, if we really care about the people that we're serving, then we want to make sure that we're giving them this information. And it allows agencies to do that in a way that is incredibly cost effective, in a way that's really simple and easy to access. And we've also done some very cool things to actually help caregivers to take their training, which can be a big, big barrier in the online training world, particularly for like staffing or employment, is getting caregivers to actually take the training. Well, we have some pretty cool tricks that we use for that too, to get people engaged.
Yeah, my mind was just literally blown when I realized that all of the in-home caregivers that I had encountered, that I was teaching as a home health therapist, how to follow through with the care that we just kind of came up with this patient. And at first I thought like, oh, maybe I'm just getting somebody who's inexperienced and they haven't been a caregiver for very long. But then I realized like in the state of Missouri, you don't have to have any training. And this is not like a baseline. I don't like to tell people stuff that they already know and talk down to them. And so I was saying things like, oh yeah, we're going to use the Hoyer lift to do da da da. And they would be like, had not used a Hoyer lift before. And so we really needed to practice doing that. And they learned and they did it. But like the point is, they didn't have that knowledge, yet they're there to be able to provide care. And that's the kind of care that person needs. And so, yeah, I think that's a problem in the healthcare industry. But you as a caregiver, a family caregiver, should know that your additional help might not be well trained. And you, again, are the person who is the primary in charge of the caregiving. So you need to also pass that information on to your hired caregivers too, so they know how to care for your loved one. And I don't know, see if they can subscribe to higher standards caregiver training. And you don't got to train them. You got to listen. I need you to watch this video.
There you go. Can I share a story with you that what you were saying reminded me of? So
Sure.
I had a caregiver, this is a few months ago. She found me online. This was a caregiver in New York, professional non-medical caregiver. And actually I want to say she was working in the capacity as a non-medical caregiver, but she had her CNA as well. Because there are a lot of CNAs who kind of go into that work as well. She lived in New York. She had found our course on Hoyer's, actually, took the course on Hoyer training, and then she personally reached out to me, like personally called me to tell me how important this training had been to her. So we talked for a while. I love getting to talk to people because I like people. You may have noticed. So we talked for a while. I came to find out she'd been a caregiver for years and years, had never been properly trained how to do a Hoyer or how to use a Hoyer for a transfer. The reason that she took the course is because she had an incident with a client where something went wrong with the Hoyer transfer because it wasn't used properly, and the client was injured. And she said it was horrible. She felt awful. This is a person who cared very, very deeply about the people that she was caring for. She felt so bad that something had happened, and she told me her words were, I knew I had to get more training for me and for the people that I was taking care of. And so on her own, her employer didn't do this for her. On her own, she went out and she found higher standards caregiver training. She took the course. She ended up taking a ton of courses to help further her knowledge. And like, I think that is the quintessential example of why we do what we do and why it's really, really important that caregivers get this training, because it does have consequences. And those consequences can be positive or they can be negative. So let's make it positive by getting them what they need. And two, the fact that caregivers really, really want this information too. It genuinely matters. They want it. So, again, it's all about how can we make this easy, accessible, affordable for as many people as possible so that we can have a positive impact on as many lives.
Yeah. Ooh. It's so important to do. Still such a big need. It feels overwhelming. And I think that's like, you know this. You can't run a marathon without taking the first step, right? And while I'd argue we're not at step 1 or 2, we still have lots in both of our areas that I think we want to accomplish and see happen.
Yeah, 100%.
In a systematic way, and not, frankly, ad hoc as it is now, where people happen to find us. And it should be incorporated into the way the systems work. But that takes a lot of us to be advocating for, really, and asking for, like, getting that information and asking those hard questions before you hire an in-home caregiver, and asking the questions to your team when your loved one is getting discharged home, and make sure you have all the information. What resources are available to me when I don't remember this when I get home? And yeah, just being advocates, I think, is like really what we're saying about both of what the things we do. Providing information means that we're trying to arm you to be a better advocate, and whether it's for yourself or for someone else. And when you do that for the system too. So
yeah, Absolutely. At the end of the day, like, we all have to be on the same page. We all have to work together in order
Yep.
to really genuinely create change that we're hoping for.
Mhm.
We talk all the time, right, about how our healthcare system is broken.
Mhm.
And, each of us has found in our own way a way to help fill the gaps in that system and help to make it easier for people. But it really does take everyone working together to go down that road. And I think, like you said, through Ask Sammy, through Higher Standards Caregiver Training, hopefully we're providing an avenue for people to be better advocates for themselves, to get more of what they need, and push for the kind of change that is really required to make sure people are getting what they need, because that's what it's about.
That's what it's. That's what I was about to say. That's what it's about. Well, I think I know your motivations even better than I did before. So hopefully, our listeners know a little bit more about like how we came to be doing this stuff. And if you connect with that or have questions, please leave us comments and let us know. And we're happy to extrapolate or add to that. And then let us know what else you want to talk about, because we always want to hear from you so we can provide the content that is going to help you be a better advocate. So like and subscribe, and we'll see you next time on CareLab.
Bye.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.